Everyone, to another episode of our Special Needs Family Planning and Support Show. Today, I couldn't be more excited to have Rebecca Gladstone here with us. Rebecca is a music therapist and she works with children with special needs, but also adults, which she's going to, talk all about that coming up. But if you're just getting here and you've never watched any of our shows, my name is Aldo Venturacci. I'm in the financial planning industry alongside my partner, estate planning attorney. And together, what we do is we help special needs families really plan for their children's financial future. Now, we're growing a community of professionals around us. And like I said, this evening, we have the immense pleasure of having Rebecca here, who's going to be talking about how music can have an impact in your children's lives. And so, Rebecca, once again, thank you so much for being here. I'm super excited. Why don't you tell our viewers a little bit about you, your background, and then we'll get right into it.
Yeah, of course. Thanks for having me. So a little bit about myself. I'm based in Miami, and I'm the owner of my private practice. It's called Gladly Music. And through my practice, I'm doing a lot of work with kids with special needs. I do music therapy groups. I do individual home health music therapy sessions. Um, like I'd say 90% of my work is with kids with special needs. My internship was with adults with neurologic disorders and strokes and brain injuries and all that stuff. So it's really interesting to see how all of that has translated into my work with kids now.
That's fantastic. So, music therapy. We're just chatting for a few moments before we started the live, and it was the first time I ever heard that there was such a thing, right? And you were telling me how hard it is really to become a certified music therapist. So talk to reviewers a little bit about the process and why it's so complex, right? It's not just like playing an instrument to a child, right? I mean, it takes a lot more than that. So walk us through the process of becoming a board certified music therapist.
Yeah, thanks for asking that. It's very common that I introduce myself to people and they don't know what I do. They don't know what music therapy is, which is why advocacy for the field is so important. So I'm really glad that we can have conversations like this to talk more about it. So for music therapy, to become a board certified music therapist, you have to go through a either undergraduate or a graduate program that is music therapy specific. So I went to the University of Miami at Frost School of Music. I have a bachelor's in music, specifically in music therapy. So my classes were part of the music school, but they were also part of psychology and like biology and health classes, along with music therapy specific classes. So research and music and development, psychology of music, how to play certain instruments specifically in a music therapy context.
Mm.
So those are some of the classes I took. And then once you graduate, you have a 6-month internship. Before that, during school, you have a practicum placement every semester, kind of like in nursing school. So I was working with different populations every semester. I worked with kids with cochlear implants. I worked in hospice. I worked with cancer survivors at Sylvester Cancer Hospital. I got to do a bunch of really cool and different things. And then my internship, which is 6 months, it was in neurologic. Sorry, neuro. I don't know why I'm blanking on words right now. In like
It's all right.
neurologic health.
We all get a little nervous when
A
we're launching.
little
Don't worry about
flustered.
it.
Um, neuro rehab. That was the word I was looking
All
for.
right, neuro
Anyway,
rehab.
so I did my 6-month internship, and then after that, you take a board exam. Um, and you study for that for a bit. And once you pass the board exam, you're a board certified music therapist. And just like any other specialty, we have to keep up with research and get a recertification every few years. It's definitely a growing field, but it's actually been around since World War II, and they started it for using it with veterans, which is really interesting.
Oh wow, I had no idea. And we're gonna talk. We're gonna get into the benefits of music therapy now, so people understand. Because, like I told you, before we started here, uh, I never even, knew that it was a thing. But then the things that you told me, are really impressive. And so I want everybody watching to have an opportunity to learn how music can really, work as therapy for their children. Now, before we dive into that, if you're watching this live, then what I'd like for you to do is go ahead and type hashtag live in the comments so you're here with us participating. And if you happen to catch the replay, you're watching this later, then go ahead and type hashtag replay. That way we can also acknowledge you and thank you for being here with us and learning. Now, with that being said, um, tell us a little bit about how music and or if there's a specific type of special needs that can benefit more from music, or if it's something that pretty much anyone can benefit from. Tell us a little bit about that.
Yeah, really, any person who can benefit from any sort of therapy. So, whether it's conventional talk therapy, speech pathology, occupational, physical, anybody who can benefit from any of those things, which is pretty much everyone, they can also benefit from music therapy. Music therapy is unique because it addresses a really large variety of goals. So we work towards cognitive goals, social, emotional, physical, sensory, motor, um, pretty much any domain, executive function, behavior, any domain any other therapist works towards, we can address using music. Specifically, I'm trained in neurologic music therapy. There's a few different approaches, and I mostly use neurologic approach, but along with my own approach. But a session involves, well, it really depends. So, like you said, you asked if there's any specific needs that would
Hmm.
benefit most from music therapy.
Right.
I'd say no, but I think it's most effective. Sorry, I just had a beep. Let me turn on do not disturb. I think it's most effective with people who love music, which are a lot of people, but
Right.
some people are definitely more receptive to music. I just started with a new client the other day, and cutest little boy with Down syndrome. And he just like he hears music and starts dancing around and singing, and he's nonverbal, but you can hear him verbalizing the sounds to a
Oh
song.
wow.
So a kid who already has that is like my ideal client. Um, but it's really cool. So we do things in sessions like playing instruments, and that might be working towards a physical goal. So I have what I call a lollipop drum or a paddle drum, which is it looks like a big lollipop but a drum, and reaching to play that drum, cross body reaching, standing up and reaching, these are all movement gross motor goals. Playing the piano is going to address fine motor goals.
Okay.
um
Okay. So it's not
yeah.
really just like you playing music to
Mhm.
the child. We're talking about children now. It's actually them actually interacting with the instruments and really becoming a part of making music. Then
Oh yeah.
that's interesting.
I'd say the only time like receptive music therapy is a thing, which is just listening to music. And I'd say the only time that's really applicable for me is when I have a child who's very overstimulated, very anxious. Um, I've had a kid like recovering from a seizure and just needs something to help calm the senses. That's when we'll really just do an immersive music listening experience. So changing the intensity of music and reflecting that based off of the reaction I see, maybe matching their respiratory patterns, their heart rate, their general mood. But for the most part, it's something that they're interacting with.
Oh, that's so interesting. And so when you're with do you call them your patients, your
It depends on the setting. If it's in like a hospital, they're
okay.
patients. If it's their home as clients.
So when you're with that person, child or adult, you have you kind of read their body language and their reactions, and based on their emotions and reactions you can kind of guide the session to either stimulate them more or less and really adapt what you're doing.
Yeah, so music therapy is very reactive, and that's why it's such a specialty because we're really trained to pick up on our clients' body language and their responses to music. Um, a big technique in music therapy, it's called the ISO principle, which is basically about matching a person where they're at. So I don't know if you've ever noticed people walking outside and you hear like say there's a concert or live music going on, people will start to just sync their stepping to the beat of the
Right,
music, which is
right.
really cool,
Yeah, I mean, I
right?
do it all the time. Yeah.
Yeah. Yeah,
Involuntarily,
exactly.
right? I mean, it's just something that
Yeah.
subconsciously you just kind of fall into the rhythm, right?
Mhm. It's something called rhythmic entrainment. Humans are just naturally rhythmic. And if you think about it, our heart rate is rhythmic, our breathing is rhythmic, our walking patterns are rhythmic. So we can play on that and manipulate that using music. So we might match to their breathing and then try to change it to an ideal breathing pattern. We might match their energy. So I might come in and a kid is woo all over the place, right? So I can play really fast music and then gradually slow down and they'll follow that. They'll follow the lead if I watch them carefully. So,
Oh wow. So you're saying, like, for example, if you're working with a child that's overly anxious and they're breathing
mhm.
fast, you can actually affect their breathing through music and calm
Oh,
them
yeah.
down. So now they're probably more receptive to other things that you do also. So
Yeah,
that's
exactly.
incredible. That's incredible.
Hmm.
I mean, what does music therapy look like in a hospital or clinic setting? Meaning, like a lot of patients and people in general, once they set foot in a hospital, they have that white coat. I think it's called white coat syndrome or something like that, where you just get nervous because you're in that environment. So, how can music therapy assist other areas of say physical therapy or occupational therapy and things like that?
Yeah, that's a really, really great question. Something music therapy is really great for, especially in children's hospitals, is something called normalization, which is basically bringing the fun and the freedom of outside into that hospital room, whether that's just giving them the option to be in control of their own session, whether it's making choices and decisions, or just having fun and laughing and playing without worrying about where they are. There's also music therapists who assist within procedures. So if a child is having a procedure done, a music therapist can be there for distraction purposes and for pain. Focusing on an external stimulus like music can help decrease the perception of pain, which is really cool.
Oh wow.
And then in the neuro rehab hospital that I worked at, I did a lot of co-treatment with physical therapists, with occupational therapists, with speech pathologists, basically seeing what their goals were for the patients and then bringing in music-based interventions to their sessions and working together as a team.
Wow, that's incredible. Now, after the session is over and that child goes back home, do you normally see like lasting impacts of that session, meaning like throughout the rest of the day or maybe the week that child may behave differently because they were involved in a music therapy session with you? How does that work?
That's another great question. And that's basically part of our goal as music therapists is for the skills that we work on to transfer to outside of the session.
Hmm.
So I can't necessarily speak for a single one-time session in a hospital setting, because I think what they'll take away most from that is just the distraction and the uplift lift of their mood in the moment and maybe something positive to look back on.
Right.
But I typically see children once or twice a week in their homes, and we take these skills, um, and we try to move it so that it's not just in music settings that they're making these this growth, right? We're working towards non-musical goals. So I will have a child learn to say their name by singing it, or how to spell their name. I had one kid, we made up a song together on how to spell her name. She learned
Oh,
how to spell her name through the song because it's easier to remember song lyrics. And then we would transfer it to, hey, how do you spell your name? And her just speaking it back to me to transfer to something that you would use outside of the session.
well, that is incredible. So the child who may be trying to communicate but doesn't know how to eventually finds a way to express themselves through music by learning from you, and essentially I mean, they don't know that it's a therapy. I mean, for all intents and purposes, they're just having fun and, doing
Yeah.
something fun. And next thing you know, you're opening up a whole new world of possibilities for not just the child but also their families, right? Because now the families will also have more interaction with the child and be able to, do more for them. So really it affects all areas of life, right? I mean, it's really, really incredible. um, Somebody so young like yourself, into, in this industry, working with special needs individuals. I mean, that really says a lot about, who you are, and the impact that you're looking to make, in people's lives. So I'm sure the whole community is very, very appreciative of you. And speaking of that, I'm just curious, as our audience is primarily families here in Florida, not just South Florida, but the whole state of Florida. But we do have families from other states as well who, are interacting with us. We have, a group of families from Texas that are following what we're doing and they're really interacting with us. We actually have a webinar that's going to be coming up in probably 3 or 4 weeks, where we're going to have two attorneys talking about specifically government benefits and Social Security and all
Mm.
of those things. So this is growing, right? So let's say, somebody from Texas or from California or New York are watching now, and they want to talk to you and they want to see if music therapy will be something that'll make sense for their situation. Do you only do in-person sessions? Is there a way to do it over Zoom so that you can reach more people out of state? Are you even board certified in other states? So tell us a little bit about, that going across state lines.
Special people helping special people. I love that comment. Yeah, that is a great question. The board certification is national, so I am able to help people anywhere. And along those lines, I am launching a brand new program that is going to be perfect for reaching people everywhere.
Okay.
Um, my new program is called Notefully Nurtured, which is basically teaching parents on how to take music therapy techniques into their own hands. So it's an immersive 6 month program where each month the parents are coached on how to use music techniques to reach goals. So each month is a different goal. The first month is behavioral. The second month is sensory motor. Then we have academic and so on. Um, so that is my big way of helping people everywhere. It's going to be kind of a reverse model. So I'll have videos coaching on how to implement these techniques. I'll have worksheets and exercises to try at home. Then they'll get to work with other families via a group chat and monthly Zoom calls with those other families who are implementing the same techniques. And then they'll have access to me to ask questions for feedback and so on. And then on top of that, if they choose to, we can do virtual or in person assessments and check ins as well.
Okay. So, which
Mhm.
kind of leads me to my next question. Typically, is there like a predefined length of therapies that you do with a child, or do you have a specific goal when you start working with a child, or is it like the more you do it the better until they do something else? So So how does that work?
Yeah. I mean, we do set goals and we work towards those goals and then we meet the goals, but then we make new goals and we continue working towards those new goals. Um, so really, I don't have a prescribed amount of time that I work with clients. I've had clients who I've worked with for several years, because there are always new goals and things that we can work on through music. But yeah, that is the difference between in person or virtual sessions versus my program, because my program is only 6 months long,
Hmm.
but it's giving the parents the skills so that they can continue implementing these techniques forever,
Got
which
it.
is really cool.
And the
Mhm.
parents that want to join this program, I mean, they don't necessarily need to have any type of music background, do they?
Mm-mm. No music background needed, just a love and passion for music and a love and passion for helping their kids, and an ability and to get creative.
That's awesome. I really like it. And just real quick, if you're watching this and you'd like to get more information about Rebecca's services, but also if you want to be a part of our community and really have more access to us and ask questions, whether you have questions about your child's benefits now, or maybe something about therapies or IEPs, or on the financial planning side, that would like to welcome you to join our free Facebook group. It's called Special Needs Family Planning and Support. If you're interested and you want to join, just go ahead and type hashtag group in the comments. And then after the live, I'll go back and answer all of your comments and send you an invitation to join our group. And that way you really become a part of our community and you have more access to us. So all right, Rebecca. So I have a question that we haven't prepared for. So maybe it may be tough, but when would you say is a good time for parents to give music therapy a try? In other words, I mean, what are some signals or something that the parents should be paying attention to that might indicate that the child could benefit from music therapy?
Yeah. Good question. I do think it's really just any interest towards music. So if you notice your kid starts to gravitate towards musical instruments, if you notice that they tend to hum to themselves, to sing to themselves, if I mean I've seen a lot of nonverbal kids who will sing every word to a song, um or who maybe will only respond to sung directions. Maybe they really are super engaged in watching Miss Rachel and they're really responsive to her and you want something more personalized in real life for like that. Um it's really that's when I have parents calling me is when they say my kid is gravitating towards music. How can I use this to help them?
Okay, fantastic. An interest in music in general, or just in that rhythmic thing where they may be just reacting to music or
Mhm.
interacting with the song, then that should be an indication that at least there's a possibility that they will do well and really benefit from what you do. That's awesome. So, all the parents out there listening, I mean, if you see your child maybe tapping to a beat or maybe humming, like Rebecca mentioned, then there might be a good opportunity or a good indication, rather, for you to maybe have a conversation with Rebecca and talk about how music therapy could probably or possibly, help your child. So, um, I told you, before we started that, I'm a musician myself, even though I do nothing close to what you do, obviously, right? I mean, I did it for years. I played in bands for fun and whatnot, but learning how to play an instrument, even if you don't have any challenges, right? Just the act of interacting with an instrument and learning really creates, it kind of almost like reprograms your brain, right? Because I mean, a lot of the things that are kind of second nature to us, really have to go out the window, and we have to learn something new. and the discipline and the dedication, and but not only that, I mean, seeing the improvement as an encouragement to keep doing it. I mean, it really becomes almost like, you can't stop, right? I mean, my neighbors and my parents, as a drummer, I mean, they will tell me to stop all the time because I wouldn't. So I can see how it can kind of take a child from their everything that they're already used to, and then taking them to a brand new place where now they're experimenting things and maybe even feeling things that they're not used to feeling, right? So and I'm sure, like, seeing those smiles and nonverbal children all of a sudden starting to verbalize their names or sing their names must be really, really rewarding. Would you say that that's like the best part of your job, seeing?
It's it's really cool seeing like the growth of confidence from kids. So like you were saying, in addition to music therapy, I do adaptive music lessons, which is similar, but the goal is learning instruments rather than the goal being a non-musical skill. And in those adaptive lessons, just seeing them be so proud of what they've learned and showing it off and doing a little concert for their family or just playing something and just like making music. It's like to see that smile and the way their faces light up. I had one kid on the spectrum who I was teaching piano lessons to. He was like 6 years old and in kindergarten and went into school and had to write down um, like something that he's proud of, and he wrote down I can play the piano, and it's just like it made my heart happy. It's really
That's
sweet.
so cool. Yeah, that it makes it all worth it, doesn't it? I mean, just seeing that the child actually understands and it makes them happy, right? That's what it's all about. So we have a question here in the comments that I really want to get to because I think it's a really important question, and I know that we covered a lot of the social and emotional benefits of music therapy. But William is asking, does it enhance the learning with music and visuals? So I guess what we're trying to find out is, how about on the academic side of things? I mean, do you see music therapy helping children also with academics?
Yeah, so visuals are a really great help, especially for children. I have some visuals that I take with me to sessions um, to work towards a variety of goals, including academic goals, but like interactive, a picture of a song. Like we do the song If All the Rain Drops and we're singing that, and they can choose what kind of candy we're going to sing about. So they take that visual, they can push it on, it's like Velcro, and they can sing along with that, reading along, pointing along, all of these like additional cues in other senses, multimodal cues are really helpful. So yeah, absolutely.
Fantastic. And in that sense, do you uh, is there any communications with the school staff, the teachers, and whatnot once a child starts receiving music therapy? I mean, and how
Yeah.
does that? What are the dynamics of that? Work with the teachers.
Yeah, I love to have a look at a child's IEP at school, to see exactly what they're working on in school, what their goals are, what their academic goals are, whether they're working on certain goals with their behavioral therapists, their RBT, and I try to work those goals into our sessions to kind of reinforce them in a different setting. I've had a girl who she had difficulties with memory and she was working on learning area and perimeter at school. And I remember we wrote a song together. It was area is the amount inside to find it, multiply. And we created a visual of that on Canva together, where we wrote it all down and we decorated it. And then we started every session by singing that song together. And it started off by reading it and singing it from there, and then seeing if she could remember it, and then seeing if she could apply it.
That is incredible. That is so cool. And I'm surprised that music therapy is not something that's talked about more in special needs parents groups all over Facebook and other platforms, because it just after talking with you today, it's clear that children can benefit so very much in different areas, and you have the skills to really identify where that child could really benefit the most and really focus what you do in that specific area, right? So listen, I could be here and sit with you here for hours and talk about music, because that's really one of my passions, right? But the fact that we had an opportunity to bring this to more people who are going to be watching this over and over again, really fills my heart. As an opportunity to bring good quality information and people to our community. So um, we try to keep these around the 30-minute mark so that everybody can get value from it, but at the same time they're so busy doing other things, right? So before we wrap up, are there any final thoughts, maybe something that we didn't cover that you think are is important to talk about today?
Nothing in particular, but I would love to just let you know that I am available to reach for any questions. And I also do have more information on my website. My website is gladlymusic.com. And on there, I have information all about music therapy. I've got blogs with additional information, and I've got videos linked. And I also have my Instagram, gladly.music, where I post a lot of information about music therapy. I post videos and songs you can sing to your kids at home and all that good stuff.
Oh, that's great. So you have some of those resources where parents can maybe go to your website, get a couple of them, try them at home, and see how their child reacts, and then maybe then take the next step of of contacting you for a one on
Yes,
one. That's
the best spot.
that's
The
awesome.
best spot to find those will be on Instagram, gladly.music and note fully nurtured. Have all of that stuff that you can try at home.
Very, very cool. So I'm going to make sure to grab all of those contacts and then post them in the comment section of this video. So, and pin it so people coming back know exactly where to find the resources. Rebecca, once again, thank you so very much for being here with us and really sharing this amazing journey of becoming a music therapist and making such an immense impact on these children's lives. I can't wait. We definitely got to have you back here and talk more about this. But like I said, thank you so much, and for all of you watching, thank you for being a part of this. You are the reason we do what we do, which is again to bring education, news, tips, anything that can improve the quality of life of not only your child but also the entire family, right? So that's what we're here for, to support your special needs family in general in different areas. And if you're not a part of our group yet, and you'd like to have access to all of us and interact with us, ask questions, and really become a part of our movement, then just type hashtag group, and I'll go ahead and reach out to you and send you an invitation to join. It's completely free, but the reason that it's just not open to anyone is because we like to keep it a safe place for families to have open conversations and not really fear that some people from the outside might be peeking into these conversations. So you do need to apply, and we only let caretakers of special needs children, primarily parents and grandparents, into this group to keep it safe. Thanks again, everyone. Thank you, Rebecca, a million times. And
Happy.
until next time, take care, everyone.